Hello everyone and welcome to week 1, where we will be discussing an introduction to health and wellness as well as signs and symptoms. First, I think it's important to define health and wellness. Oftentimes in our society we hear these terms linked together, and that is true. They're very closely related, but we don't want to mistakenly assume that they are synonyms and they mean the exact same thing, because they don't. Let's first start with the term health. Classically, health is defining a state of being for an individual. Oftentimes we will classify this as being in good health or poor health or somewhere in between. The state of health can be quantified, meaning somebody can measure it. Oftentimes we measure this in terms of blood pressure, cholesterol levels, other items in blood work, weight, so on and so forth. So we want to realize that health is really the outcome of the choices that we've made and the decisions that we've made in our day-to-day. Now that links us into wellness, which is more of those decisions, choices we make, and the journey that we go on throughout our life, and the consequences of our wellness choices culminate in whether we have poor or good health or somewhere in between. The people in between oftentimes are notified by a provider that maybe they are at risk of developing cardiovascular disease, or they're pre-diabetic, or their blood pressure is getting a little high. At that time, they can make some wellness choices to hopefully improve their state of health. I would now like to discuss some differences in two different views that are commonly held in health, and that is the Western view of health versus the holistic view of health. The Western view is what we might consider the contemporary medical view here in the United States, where most people are looking for there to be signs and symptoms of a problem before they seek out a treatment option. So sort of the old adage of if it's not broken, don't fix it sort of comes into play here. And what we're looking for is sort of regaining health once it's lost. This is in contrast to the holistic view of health, where they're hoping that we're going to make strong wellness choices throughout our daily lives in the hope of decreasing chances of having diseases and disorders become a part of our daily life in the future. So we're hoping that in the holistic view, we're looking also not just at physical numbers like weight and blood pressure, but we're looking at someone's mental health, their emotional state, spiritual well-being. Do they feel like they have a great sense of being in their life? It doesn't necessarily have to be religious-based, but do they have a sense of purpose? And that can be really, really important. How's their financial wellness? That really weighs heavily on a lot of people as well. And occupational wellness. Work takes up a great deal of our adult life as human beings here in the United States. Do we dread going to work? How does that affect our health if we do? So the holistic view is really looking at all 8 dimensions of wellness, which we'll talk about very shortly, but also looking at ways to improve health and before signs and symptoms occur. Can we get ahead of some potential outcomes? And that's really what we're looking at here in the holistic view. Another thing I'd like to talk about in regards to wellness is how it has been defined differently throughout generations, especially in our country. At one point in time, many people were very active. They were out in the community. They would probably have chores at home in the farm, then go to school if they were children, or go to work at a factory to earn additional income, then come home and finish daily chores, homework, prepare meals, things of that sort. Things changed as we moved more toward urban areas and became more industrialized. And more from that, we've moved toward technology as well, where people are now, instead of going out and riding bikes until it's dark and your parents call you home, children are more video gaming and things of that sort, or watching television more often, in part because it's more convenient, and also in some areas because of safety concerns as well. Unfortunately, we can't have our children go to the parks on their own as readily in many communities these days as you once were able to. So society certainly has changed things. So in speaking with older patients that I have from generations above mine, they view health a little bit differently, and for them, things are not as great a concern about where their food comes from because they're used to things always coming from local farms and such, and they're very active, and many of them work well into their 70s and even 80s, so they're constantly getting that physical activity, whereas I'm seeing the younger generations, it's sometimes challenging to have school-age children to be active. They're sitting at school, they're sitting on the bus, they sit and watch TV and play video games, and they're not getting as much physical activity as they can, which is in part one of the reasons why we're seeing such a spike in the epidemic of childhood obesity in this country too, which is something we'll talk about at a later date. Also, in the 70s, late 70s, early 80s, we started to see home videos come about with Richard Simmons and other ones where you don't have to go to a gym now to work out. You are able to do it in the comfort of your own home, which has really opened up a lot of opportunities for people. And we'll talk about this when we get into the exercise unit, that in the 2000s, there were a lot of things with P90X and The Biggest Loser. Those trainers put out a lot of videos for people to do in the comfort of their own home. So we've certainly seen some big changes in just the last century in how people look at fitness and how they fit it into their day-to-day. Because this is also a biology course and you do get some scientific method credit for this, I want to talk about a very important term in anatomy and physiology, and that term is homeostasis. Now, don't worry about how to spell this. It's written in the lecture unit, so you have that spelled out for you. But homeostasis is really important because that talks about the equilibrium or the balance that a human being has in order to sustain life. For example, right now, it just happens to be that I'm filming this in the middle of January, and it's 2 degrees outside, Fahrenheit. That's pretty cold. So if we were to stay out there for any length of time, our body would go through some changes to try to keep our internal temperature at 98.6 degrees Fahrenheit. One of the first things is obviously that we would have goosebumps to increase the surface area to try to get more warmth in, and then very quickly our body would start to shiver. This gives a mechanical heat produced by our muscles to try to bring our body temperature back up. Some other items would happen if that didn't occur, but hopefully we would get back into some warmth ourselves. And then dressing in layers and other things helps with homeostasis. But what our body is trying to do is keep us at that temperature. Now, the opposite, let's say in the middle of July when it's really hot out and our body temperature starts to get too hot, well, our body still wants to bring it back down to 98.6, so we would likely sweat. And that would cool off our bodies as well. So our bodies are constantly responding to our changing environment and ultimately trying to keep us at a range where we can sustain life very well. What happens as we get towards an inability of our body to maintain homeostasis, then we start to develop illnesses, diseases, and disorders, and we'll talk about those later on as well. With those diseases and disorders, we get what we call signs and symptoms. Now again, oftentimes we hear these two terms discussed together, and that's helpful because they are very closely related. However, they are not synonyms again. They do not mean the same thing. Let's first talk about signs. Signs are more objective. These are things that a healthcare provider can observe. Someone else can observe in you. For instance, it might be an open sore. It could be high temperature, high blood pressure, something that can be measured. For example, height and weight as well. Symptoms are more something that's subjective, meaning it's not going to be the same in everybody. This is something that a patient has to describe to someone. For example, the biggest one here is often pain. On a scale of 1 to 10, someone else's 5 is not the same as mine and not the same as yours. So we have to realize that there's some subjectivity. It's a little different from person to person. What makes somebody feel really uncomfortable to the point where they need to call out from work might not do the same or register the same as someone else because there's a perspective there. Someone might register a symptom a little bit different. Some other examples of symptoms would include dizziness, nausea, fatigue, being really tired. These are items that someone would have to describe. You can't look at someone and say, oh, they're on a pain scale of 6 to 10. They would have to tell you. So that's why we take the things that are observable and objective and the things that someone has to tell us as a patient that are subjective, and we put them together oftentimes in signs and symptoms in order to determine a possible diagnosis. The last point I'd like to make here is let's ask ourselves, who is responsible for our health? For whether we're in good health, poor health, who's responsible for our health and our wellness choices? And ultimately, it's us. As an individual, we are ultimately responsible for our own choices. Now, are there influences out there that might make it a little more challenging or easy for us? Absolutely. And the first one is our family. The first 18 years of life, it's really not our choice oftentimes how we eat, when we eat, how we exercise, when we exercise, how often we go to the providers. We are really relying on our parents or caregivers at that moment in time, and we're learning a lot about that information too. So in addition to genetics, we're also getting learned behavior from our family unit as we age about the importance or lack of importance of wellness in our daily lives. The media certainly influences us a lot. Fast food companies really market a lot about how inexpensive their food is, and certainly their food is of a certain quality oftentimes. And if somebody is having an infomercial and they have the most amazing pillow or mattress or other device that's going to prevent you from ever needing a healthcare provider, just call right now for $59.99 and we'll also send you this free and things of that sort. Those types of gimmicks that are out there too, and some of them can be useful products and some aren't. So certainly we have to be careful as consumers whether we're purchasing something that really is going to be beneficial to our wellness and health, or if it's just someone trying to make money. Another item is certainly finances and health insurance. That can be a challenge for many people in order to be able to go to a provider. I know growing up, it had to be the last possible choice to go see a healthcare provider because we never had health insurance growing up when I was a child. So certainly that has changed. I've worked really hard to make sure that we have health insurance for my family, and that we do other items on a regular basis as well with alternative care to try to prevent the number of times that we really have signs and symptoms. So I would just like you to think about in your own life for a few minutes about some things that maybe are challenges toward your wellness, and if there's some ways that you can make a 1-year or 5-year goal to improve that so that ultimately you're improving the future health and wellness of you and your family. I hope you enjoyed this short lecture. As I mentioned, this is not inclusive of everything you need to know for this unit, so please make sure that you are reading the text for this lecture 1, that you're looking at the PowerPoint, and then when we get to quiz 1, that you look at the study guide I've provided for you and make sure that you're able to discuss all of the items there as well. I hope you have a great week, and I will talk to everybody in the discussion forum. Have a good week.